Good evening. In March this year, the country was enveloped and hemmed up in the fear of contracting coronavirus. This eventually compelled the president to lock up the Greater Accra and Greater Kumasi to control the spread. Many people lived in fear of contracting coronavirus. 3 weeks of lockdown, the urban poor became poorer. Many lost their jobs and are yet to recover from what they lost. There was a strong need to educate the public and also get burning answers from government and also scientists. That is how the lockdown was born. We gave you the microphone to articulate your burning concerns. In the comfort of your various homes, you sent your nagging questions to us. Then we redirected them to the right authorities to address your pressing needs. As a matter of fact, even the father of the land, President Akufo-Addo, could not afford to miss the lockdown, which eventually became beyond the lockdown. I'm sure you can see the photos as evidence of that. Now, it is true also to say that when you speak to us, the president hears you. Our relationship became intimate and engaging, giving birth to knowledge which helped curb your fears. It has been an exciting, grueling experience, and you have been a willing participant. We say thank you, Ayeko, for making a date with us every Sunday evening at 7:30 p.m. here on your JoyNews channel, also on DSTV channel 421, GoTV channel 144, affiliates across the country, and then also on myjoyonline.com. We trust you would apply all the knowledge we served you, because remember, COVID-19 is still real and is still very much with us, even though we are controlling the figures. Today is the time to evaluate how the country has handled COVID-19. We have the Information Minister, Kojo Oponkroma, the Deputy Health Minister, Dr. Bernard Okuboy, and of course, the Director General of the Ghana Health Service, Dr. Patrick Abuaje. Today is sadly the final lockdown. It does not mean, however, that coronavirus is over, but this platform and time slot will give birth to another show that will continue to serve your various needs. You must not go anywhere. We'll unveil another baby. Don't move a muscle. I am Emefa Apau. I welcome you once again to the final lockdown. But before we settle, we'll take a look at Ghana's COVID-19 figures and our status as a country. Once it's ready, we'll get through that. So our new cases now stands at 34. That's our situation as a country. It stands at 34 COVID-19 situation. Our total confirmed cases since we first recorded a case in Ghana is 46,387. That's where we stand, total confirmed cases. Our active cases now is 470. Our recoveries plus our discharge is 46,387. And our deaths, sadly, is at 299. This is the lockdown. I'll be right back, then I'll introduce my guests. We'll take a look at the journey so far here on the lockdown, through to beyond the lockdown, and now the lockdown. Do stay. Thanks for staying with us here on the lockdown. Sadly, like I said, this is the final one. But of course, we have more in store for you, and we'll definitely let you know before the end of the show. But before we begin, let me take you on the journey so far, how it all started to where we are.
Fellow Ghanaians, good evening. The Minister of Health has confirmed 2 cases of COVID-19. The cases were confirmed on the 12th of March, that is today, 2020. And the first cases to be reported in Ghana. Laboratory results of the 2 confirmed cases were received at the same time from the Noguchi Memorial Institute for Medical Research. Both individuals returned to Ghana, one from Norway and the other from Turkey.
Effective 1 a.m. on Monday, 30th March, some 48 hours from now, I have imposed, pursuant to the powers granted the President of the Republic under the Imposition of Restrictions Act, 2020 Act 1012, restrictions on movement of persons in the Greater Accra metropolitan area, GAMA, which includes Awutu Senya East Municipality, and the Greater Kumasi metropolitan area and contiguous districts for a period of 2 weeks, subject to review.
Good evening and thanks for the opportunity. This is Seth from Ablikuma. So I want to know from the Honorable Minister if we have some sort of a contact where we can have online consultation, so that common code is still there. We will have common code, right? So that they could ask me some questions. How do you feel? Do you feel this? Do you feel that? So that we all don't rush thinking we have the virus and then calling the 112 contacts for us to be taken care of or something.
This afternoon, earlier, you during your update, I think the chief of immigration, if I am right, made mention that they are not going by the humanitarian approach. They are strictly going by the combat, and I think that's the way to go. Why? Because you see, when we leave things to chance, this is serious business. Remember, if somebody do not fall in line, it's better to whip their asses off than later for them to find ourselves for them to infect everybody, find ourselves in isolation.
So that you don't understand what the president said, don't worry, just keep calm. On Joy 99.7 FM for our radio audience. Also on myjoyonline.com, we're live.
What is going on?
This is not the time to be making prank calls to ask, does it work? And I'm a fraud testing line. Indeed, if you've seen the data on the prank calls, it far outweighs those who actually call.
What a journey it's been, and the two gentlemen are here with me in the studio. Information Minister Kojo Ponkroma and of course Dr. Bernard Okoboy, the Deputy Health Minister. Welcome, gentlemen, to the final lockdown.
Thank you.
Unfortunately, it has to end at some point, but we ended with that picture of the president watching Dr. Bernard Okoboy on the lockdown. It was beyond the lockdown at the point. Watching that picture, then, was the president really watching? Did he call you after that? What really happened? Did you say anything wrong that the president had to correct you on that night?
You know, the pandemic started with an unpredictable path. And so if you watch, even in the communication or in trying to deal with it, we've not been, it's not all been perfect.
Yeah.
So at any point, we keep on learning, you know. And I said it in the earlier stages that that's one of the features you need in managing a pandemic. You ought to be flexible, or you don't have to be rigid, because in the face of new knowledge, you ought to direct your steps and orient yourselves. And so we've been taught a lot of things, and we've also tried as much as we can to impact knowledge. And I think so far it's been so good.
Well, Mr. Ponkroma, this show was bet on your love, I should say. We called you at the very last minute when people had questions about the lockdown.
That is true.
What a journey it's been. I'm sure you can recount to us. You first remember when we placed that call to you to start the show.
I do. I mean, I recall even from the index case itself, as was recorded in Ghana, and how it came to us as a surprise, because you realize that by then we had started screening at the airport, and we had just announced travel restrictions or travel advisory, about countries with active cases of beyond 200, etc. And then I recall that evening after we had finished the daily task force meeting, and I just got home, and then I got a call from the health minister at the time that there was an emergency and we have to reconvene at the health ministry. This was around 10 p.m. And I didn't quite think we had recorded a case. I thought it was, these normal emergencies. So I rushed to the ministry, and then in conclave, they broke the news to us that we had recorded the two index cases, and we had to prepare to deal with it. So quickly we scripted, a press statement. I remember calling Emma Morrison here at the time and telling her that we're going to go live on our Ministry of Information page. And the trick was that I didn't want to give it away, because knowing those of us who are in the news, if I tell her too much, you may break the news before we do it. So we had to manage it. And then since then, you called that there were so many questions, and we tried to come up with this partnership. And I think that we can only commend Multimedia, commend JoyNews, commend you and your producers. You have done a fantastic service to the nation. since March, and I think posterity will judge you well for this.
We have a lot of impact stories coming in that people have sent via WhatsApp along the line. We'll get to go through it. But as it stands now, we've walked a journey to where we are in terms of the management of COVID-19. But what's our current situation? Maybe we just look at that. Then we can move on and talk about some of the impact stories and the things that we've done and if they've yielded results. Dr. Okoboy, do you have the latest, the current situation as we stand? Today at the Minister's press briefing, it came up briefly, apart from the other issues that came up. But do we know our current situation as a country? I just put out some of the figures, but you know it keeps changing.
So I think it's even better when what we have on the page, on the Ghana Health Service page, is what we also speak to, so that it wouldn't be like we are. Okay. So I think we are doing an active count of 470, and the total recovered cases, we are looking at about 45,618. When I calculated, we are doing about 98% recovery, and that has more or less been the trend, since the beginning. Our mortality also still stands at about 0.6%. It has always been between 0.5 and 0.6, which is quite encouraging. We've had 299 deaths, unfortunately, and when you strike the percentage, you do 0.6%. The testing regime too has been encouraging. We've done a total of over 477,000 tests. These are PCR tests, 477,192. Now, what I'm excited about is that the enhanced testing comes about 290,730. with routine surveillance being about 174,000. Now, what this means is that if we had not gone tracing people and going after them, we would have been having a country total, positive test of about, we would have had a total test of about 174,000. Okay. Now, if you do 174,000, you wouldn't have had this number of positives. So the enhanced contact tracing was a very, very important feature of our management of COVID, and it has played a key role in our success story, because it is only when you pick early that you can prevent the person from sliding down the path of going critical, in terms of state. So that is also very, very encouraging. So far, I think that is our situation. The airport, because we are now, the figures look encouraging. The single biggest source of risk, which you want to control very well, is our airports. And that's why the testing so far is important. There's
a lot of controversy coming from the airport, which we'll tackle along the line. But the criticism is that we are not testing as much. That's how come maybe our figures are going down. And the allegations of massaging the figures, government massaging the figures, keeps coming up. Maybe that's why we have the low numbers of active cases. That's the criticism.
So let me speak to those two things. Throughout this journey, we've had to battle this perception that initially came in suggesting that we were massaging the figures. Yeah. And consistently, I think we have been successful in showcasing that we have nothing to hide. Setting up, as part of the transparency model, a website that regularly updates. And the evidence out there is that if indeed there were more numbers or more deaths than we were mentioning, you would see it show up in morgues and in hospitals and other parts of the country. So this claim of suppression of figures, I think it's been dealt with. Secondly, the claim that we are not testing enough also is not correct. Testing is a product of active cases, because we are testing two categories of persons. Persons who are contacts of positive cases and persons who are at risk close to these contacts of positive cases. So if you have 10 positive cases, and let's say on the average they have 10 contacts, then you are testing about 100 people. You remember about 2 months ago when our active case counts was about 7,000. If each one of those 7,000 people had 10 contacts, that's 7,000 multiplied by 10. That's the number of tests you will be doing. If today your active case count is down to 470 and the new cases are about 34, then you're going to be testing 34 times 10 plus those who are in the at-risk population. So yes, the nominal figures of tests may have come down, but it is not because there's a deliberate attempt to stop testing or lower the testing. It is because testing is as a product of the new cases or the active cases. In fact, there are three things that the president led us to do that, in my view, have contributed to the change in the story about Ghana. Number one was a decision to do this enhanced contact tracing and testing, not just limited to sick people. You recall the initial WHO guidance was that if persons show symptoms and come to the hospital, test them. What that did was that in many of the other parts of the world, by the time people showed up at the hospital, if they had symptoms and if indeed they were positive, many of them would have been in an advanced stage. If they have underlying conditions, it will now be popping up requiring ventilators. This is why this whole conversation about ventilators and critical care beds, etc. came up. That single decision that the president took, that go for an enhanced contact tracing. I recall that meeting. You know, he used to do these meetings at 6 p.m. every day, and then he moved them to once a week as things improved. I recall when he asked them that, is it or is it not true that you can actually find a positive trait when the person is not sick, i.e. asymptomatic? And initially the doctors and the scientists were iffy about it, and they asked for some time to come back, and they said, yes, you can. Then he says, voila, why don't we introduce this enhanced contact tracing? And what it did was I changed the dynamic. People now went into homes during this restrictive lockdown, because you recall then we mentioned that a lockdown on its own without more is not the panacea. If that is what you are following, then we'll still be locked down by now because we still have active cases. But that decision to lock down, allow them to go in search of the virus and try and get ahead of the virus made a difference. Second thing is a decision to profile and not hospitalize everybody. Russia, Italy, Spain, UK, what a lot of them were doing in the beginning was that once you test positive, they hospitalize you. Ghana introduced a profiling system. So after you test positive, they profile and say, can MFR be treated at home?
Yeah.
If so, then we don't need to burden the hospital beds, etc. And also, if you are doing enhanced contact tracing, then it means we can find this positive before they fall sick. It made a difference. And then this third decision of the mandatory quarantine. We were one of the first countries to do this mandatory quarantine. If 2 cases shot us up to about 7,000 at a point, imagine what would have happened if all of those 100 and something cases that were arrested in the mandatory quarantine process had been allowed into the Ghanaian jurisdiction. For me, these 3 decisions by the president has saved lives.
But some have also said that we could have shut our borders earlier than we did. Is one of the criticisms.
Again, you can watch. Again, you can watch when cases spiked in places where people were traveling into Ghana. When Ghana had its index case, and how quickly it took us to shut our borders, and compared to other jurisdictions, and you realize that that argument doesn't hold. Okay.
Well, but Dr. Okoboy, you know, other countries, you heard Mr. Oponkoma mention also that we've heard some other countries, you know, going back into a relapse after they were successfully managing their COVID-19 cases. So we are jubilating cautiously, some have said. We've heard from the scientists say that COVID-19 is still real. We may have managed our cases. We are, 470 active cases. But what measures exactly are we putting in place to ensure that Ghana does not go back into a lockdown, for instance?
Well, I think you don't change a winning strategy or a strategy that appears to be giving you results. As a country, we've all accepted that the wearing of masks has been proven scientifically to help prevent spread. And so we have to keep to our mask wearing protocol. The distancing and avoiding large crowds, because large crowds is actually a very suitable situation for spreading the virus. And and then the washing of hands, the use of sanitizer. I think sanitizer use has become part of the lifestyle of most, if not all, Ghanaians. And that is also very impressive. You see, because you are dealing with a virus that is invisible, even when your steps, the actions you are taking, the compliance is yielding results, you don't see it with your eyes. So you think that, well, I mean, that I'm just doing this and maybe it's not the reason why my situation is good. But these have been proven to help improve, this COVID situation, and to prevent countries from sliding into second waves and all that. So the protocols have played a role. We should also remember that as a country, leadership has been very solid. I mean, from the top. The last time the president gave the address, as a country, we still have not opened our beaches. Our pubs are still closed. Nightclubs are still closed. It's open air or drinking spots that are open.
But there's total disregard for social distancing. I know.
I'll come there. I'll come there. But the point is that large, conventions, churches, all those things are in the freezer, are on ice. Kids at home, when in other countries they allowed them to go back thinking that their situation was good. But we have been very cautious. So once you have a situation where, as a country, there's restriction even on school going, it's now GHS2 who would be going back, all the rest at home. It's an indication or a signal that we are being very cautious, even in the midst of an encouraging situation. And it is such a behavior that can sustain the picture, the good picture we are having. Yeah. And unfortunately, it's not only with COVID, but with all conditions. Any pandemic, epidemic, or any disease, once its mortality is very high because there is not effective treatment or there's no vaccine, people naturally, out of the outcome, that high deaths, want to behave themselves. It's a paradox. Once you start doing well, unfortunately, some start to take that as consolation, that even if they misbehave, there is an improved system. And that's why we have to continue to educate. Yeah. Education is what makes people understand that the danger is still around. And I always say that there can be only one active case in Ghana. You can be the one to interact with that active case. So until we have the 0 active case, and even beyond, it is smart to assume that the virus is near you so that you can preserve your current situation.
So there are concerns about whether we have a new strain of COVID-19. Is it still the same that was first recorded in Wuhan, or it has mutated?
Well, you know, if you look at the map, the genome or the map of a virus, you can have some mutations which are not significant.
Okay.
When a mutation is significant, it means that it is more or less a new organism altogether, such that what works with the SARS, the COVID you know now, wouldn't work with this. I don't think across the world, I've not seen a scientific journal that has reported a significant mutation which is behaving like a new strain or a new virus altogether. Okay. Remember, this SARS-CoV-2 has about 50% similarity to Middle East Respiratory Syndrome, which is another type of coronavirus. So viruses themselves share some similarities. But once they differ greatly, then they become a new virus altogether. We don't have a new virus altogether from this one. But you can have some 1 or 2 sequences not looking exactly like what you have in, let's say, Europe. Europe's own can look, 1 or 2 sequences can be different from North America and all that. But largely, it is still the same organism, behaves the same, moves the same.
Okay. Well, so you're still here on the lockdown, here on the Joy News channel. We call it the final lockdown because it's over. COVID-19 is still real, but we can't continue to dedicate a whole show Sunday evening just for COVID-19 related issues. But we still have to adhere to the safety protocols in place, wear our masks, and do all that we need to do to ensure that we do not spread the COVID-19. The Deputy Health Minister, Dr. Bernardo Koboy, is my guest in the studio. We also have Mr. Kojo Oponkroma, the Information Minister, as my guest. So in all this, at some point there were announcements about social interventions, free water, free electricity, and then for frontline health workers, they had some, incentive packages that were put together for them. That's aside the noise about the PPEs not being available and all that. But recently, we were told that now free water up to the end of December, the end of 2020. Yes. How about electricity? It stays the same?
That has not been added yet. But let me take you back. Right from the beginning, the president announced a 5-pillar strategy. Yeah. And I think sometimes when the numbers look good, people just forget and overlook it. I just want to go over it. The first challenge we have had, because this is a virus that's emanated somewhere in Asia and then came into our jurisdiction, the first challenge has been to prevent the importation of cases. That's why we even had to close the borders. And even in opening the airport, put out this elaborate mechanism to ensure that we can identify and arrest potential carriers and ensure that they are given some supportive treatment. Yeah. And I think so far the evidence is that that has been successful. The second has been to manage the spread. Of course, initially you saw a spike from Greater Accra, Kumasi, other parts of the country. Now there are over 5 regions that don't even have active cases. We are bringing the numbers down gradually because of what we are collectively doing and in following the guidance that is being put out. So that pillar has also been successful. Then the third has been care for the sick. And as I mentioned earlier, the combination of the mechanisms that were put in place, enhanced contact tracing, profiling, ensured that what our healthcare workers were doing, and we continue to celebrate them, has been successful, over 90-something% recovery rate, very low mortality, and so care for the sick has been effective. Okay. Now, 2 things come out from your question. inadequacy of PPEs. So when we realized that the world itself was short of PPEs, the president took a decision, let's produce some locally. Initially, there were complaints. I recall being on your show, doctors, nurses coming in, various levels of interventions, to the extent that now we have more or less an audit system from national across down to the district that has the registered nurses, the medical association on board, so that they can all track and see, because you were having seepages and leakages at some of the storage facilities and sometimes in the hospitals. So gradually, the production of local inputs has helped to fix that problem as well. And then finally, the president said we need to mitigate the socio-economic impact of this. So free water, free electricity as part of the socio-economic mitigation measures. Generally because, yes, we are in a crisis situation and leadership must show compassion to help alleviate the pains on people, but also more importantly because COVID is about hygiene, personal hygiene, and water is a critical, if I can use the word, ingredient in this battle. That is why you see that even when electricity has not been extended further, water has been extended further. And you add to that some of the other social protection measures that the president introduced, support for little businesses, specific industries, etc., so that we can alleviate the pain on the Ghanaian. If you go back to that 5-point strategy that he put down in March, and if you look at where we are today and the results that it has birthed, we have to be cautious, but I think we can also begin to acknowledge that leadership has dealt with us well in managing this crisis.
But the implementation of these social mitigation drive that you talk about, there are those who still say that even though water is free, they are still not getting it. The taps do not flow, yet we say that water is free. They go to the public toilets, for instance, the fee is still the same. They haven't reduced the prices. If it's 1 cedi, they're still paying 1 cedi to access the public toilet and all. So it appears that it's not everybody. That
in fact, I was in one constituency quite recently where the chiefs raised an issue that they had provided their community water for free and they were waiting for a refund from the district assembly, and it wasn't in yet, and the DCE was working to ensure that the refund was made available to them. In fact, for everything you do, there will be some bottlenecks. And in the management of this pandemic, we've been literally walking in the dark, trusting that the man at the helm of the ship is making the right decision. Sometimes in the implementation, there are bottlenecks. But I keep making the point to you that when we get the specifics, that it's this district, or it's that particular place, or it's this place where this problem is, then you can get local authorities to get involved and resolve it. But I think
was
if
there
we have
a special dispensation, for instance, for those in the slums? Did we do anything special for those?
It was general across board that water is to be free. That is, public water is to be free, because you cannot commandeer private water and make it free unless you are paying for it. So public water is to be free for this period. In places where they didn't have access to water, what we did was to make efforts to ensure that we could move water tankers, etc. in there. There was one classic case I recall where the person actually called our call center, and the vice president is the one who was there to pick the call and gave the response that we'll get water, and water got to them. So in places where water, in terms of pipe-borne water, was not available, we even made the effort to send in tankers. Were we 100% successful? I'm sure you'll find 1 or 2 or 3 persons who say, I didn't get it. But overall, did the exercise work? Again, I think that Ghanaians would agree that overall the exercise has
So talking about the call center, what's the status of the call center now?
It's still running. It's still running. Of course, the number of calls and questions have dipped. At the peak, we got about 400,000 interactions, both online and coming through the calls. It has, tapered down a bit. Now other agencies of government are also coming on board and using it in furtherance of their exercise as well. But it has been a major tool that allowed us to provide retail information, because not everybody could get through on your platforms, etc. But you can call, and then those are the call center. Sometimes take the numbers, and then they'll check and give you feedback, etc. I think all in all, it served us very well.
Also, are people still afraid of COVID-19?
Yeah, I see. I still see a significant number of people wearing the mask. Admittedly, you find some people who don't wear the mask. But the bottom line is that once people still wear the mask, it's an admission that a lot of folks are conscious of the fact that the virus is still around. And what I tell people is that there are many medical conditions that we have not witnessed before, but we reduce our risk of getting it by moderating or by changing our lifestyle. And that must be the general rule. You don't need to come across it before you intensify your preventive measures. One classical one, which we've taken for granted, is HIV. When it came in the beginning, a lot of folks were scared. But just like we studied about this virus, we knew how it moves from one person to the other. The ABC campaign started, and our prevalence and condition as a country is way better than what it was some 15 years ago. So the education, we don't have to get tired of educating people. And one thing you must know is that there's a difference between knowledge acquisition and behavioral change. You can give the information to folks, but whether it will translate into a change in behavior depends on the consistency with which you do the education and your perseverance. We must continue to persevere. Yourself, the media, you ought to continue reminding the citizenry that COVID is still around. Yeah.
Well, but it appears that we're all relaxed on this whole COVID situation. It appears for you, your ministry, for instance, you're less busy now. It gives the people the impression that nothing is really happening. We can go about our normal duties and we are free. The
relaxed mode is a default mode. Like I said, naturally, you know, it takes effort to put a room in order, to make a room tidy. But you don't have to do much to make it messy. So it's the same mode with human behavior when things get better in managing a disease. The natural default mode is to start relaxing and all that. Remember, putting on a mask is a conscious effort. It doesn't come automatically. You must pick it up, tell yourself that you are doing it for a purpose. But once things start getting better, the natural human nature is to go back and relax. That's why you must continue reminding people and then persevere. It's very important.
Well, thankfully, both of you are campaigning. And you just mentioned that rallies, big events, there's still an ice on it, and the ban has not been lifted. I'm wondering how you people are going about your campaigning, for instance, because it's not just you. You have others who are also vying for various seats at various levels. The president and the rest, they are all trying to campaign and win the hearts of the Ghanaian. But I'm wondering how you're going about it. I've seen a number of campaign launch, and I don't think that you're all adhering to the safety protocols.
I mean, I think the reality out there is that it is difficult when you have a spontaneous gathering of people to enforce social distancing, or even if you can't enforce social distancing, at least ensure that everybody's wearing a mask. What I do is that when I go out campaigning, I have masks in my car. Okay. So when I stop at various villages, etc., and people come close, because, I mean, let's be honest, when people see their political figures, etc., there's a lot of excitement. Somebody wants to hug you, somebody wants to, hold you and say something to you. You try without being, obstructive, and then you can try and make some masks available. But the truth is that there are several instances where you see that people are not complying. I've been in places where spontaneously you see people get out of their shops, get by the roadside. At
that point, do they forget? When they see you.
And I think all that we can do is to continuously encourage and get the message and the education out there. That even when you are excited, even if you're in your shop and you've heard that the president is passing through. I recall a classic incident in Koforidua when the president finished his interview and was heading out of Koforidua and was driving through the principal streets of Koforidua. I mean, it's not organized, it's not done by party. Women, men just coming out of their shops by the roadside, no social distancing.
Are they not spreading the virus?
Well, we can only continue to encourage and educate people that even when you're excited, please do well to wear the mask. At least, even if you can't observe social distancing, do well to wear the mask. We must admit it's a difficult time, and all of us as politicians, especially, and all of us who are, may I say, the leaders of these exercises that bring people out, have to do well to at least message about COVID-19 as part of your messages and encourage people to at least wear the mask. It's difficult, but it's got to be done.
What are you doing differently?
So similar to what my brother talked about, minister talked about, I also carry the mask along. And you see, in such times when you give anyone a sanitizer or a mask, that is actually life. People put a lot of value on it. So in the midst of the pandemic, you have to be conscious to use it to support, people, And one other thing is that we are also not, I'm not organizing big programs where the numbers would be big. You try to do it, maybe a meeting of elders and targeted groups like Union Chairman, GPI, TU, the churches call their elders. You don't want to do very like huge where crowds would come and all that. So those ones are very important. And when this issue of people forgetting themselves when they get excited, there is a physiological or scientific basis. You know, there are chemicals in your body.
Data and science to it.
Yes, yes. There are chemicals in your body that are inhibitive in nature. They make you slow to activities that can harm you. Okay. You know, so there are chemicals also that take that away, so you can do anything. And excitement, the hormones that come into you when you're excited, tend to suppress this one. That's why people who are very shy, when maybe they take alcohol, some can then all of a sudden change, because alcohol suppresses the inhibitive hormones in the body. So really, it's not an easy fight because it's physiological. The fellow can be someone who is very fussy and very detailed about protocols, and all of a sudden when they see,
responsible person.
Yes, when they get excited, physiologically all is put somewhere, and then you know. So it's a delicate path, but we are also very much aware that if you don't manage it well, it can serve as a source for throwing your situation out of gear, and that's why we are all being moderate.
But why aren't we opening up our beaches? If we can go to the beaches, the cinemas, and still wear a mask and be socially distant, or you don't trust that can happen at the beaches and the cinemas?
No, so what I've noticed about the president is that before he signs off on any request, however, I should be in the room to see the kind of interrogation that goes on. Uko is there with us. It's like writing an A-level session. And I recall the last one, that Sunday afternoon, I think I even came on your show right afterwards, when they provided a whole brief on why the airport can be open now. And the whole PowerPoint presentation went through it. He said, if what you are telling me is true, the airport is not far from here. Let's go. And let me go and see
and
it.
He went.
And he went. Okay, so assume I've just arrived. What do we do? Then they took him through, okay, so here's but you told me this, but you told me. He interrogates the process. And when he is not convinced that the persons who are advocating for certain opening have the ability to contain the situation fully, he will make that decision. So take the kids beyond JHS2, etc. They've done a number of scenarios, they've gone through it. At the end of the day, the risk is still a bit high. Mr. President says, no, don't go there. If you take the beaches, for example, I'm not sure anybody going to swim actually wears a mask.
But he's walking.
I'm not sure. No,
but we are told that salt water has a way of dealing with COVID.
I don't know the science about that one.
Is that true? It's not true.
It's not.
Salt water has nothing.
I don't know the science about that. And then you're at this beach and waves, all of this noise, and people are speaking and shouting on top of their voices, etc. I'm not sure they've been able to come convincingly that they're able to keep it under wraps. And
but who will push for that? Is there anybody pushing for the opening of the beach?
What happens is that the task force has representations from all the ministries, departments, and agencies. Okay. And you come and make a case for the various aspects. I remember Honorable Isiama, you see he says sports, making a very strong case. I mean, very, very fired up case. And the president listened, asked him, they went through it and said, you need about 2 more weeks to tidy up these joints. And he was very disappointed at the time. Golf got its way, you know, football didn't get its way. And then they went, did some more work and came back. So as the ministers and the persons, you know, responsible for the various sectors make a case for each one of those, and then they interrogate. And the president has a strong team of advisors. Dr. Asamoah Ba and his team have been fantastic. Dr. Nsia Sari, etc. The team of advisors with the president have been very fantastic, helping him to analyze and question and query all of these requests that are coming in. So it is in striking this balance that some are opened yet and some are yet to be opened. And hopefully when they do the follow-up work and the president is convinced that it can be contained in that area, then he will sign off on those ones.
By the end of December, should we see
I cannot put timelines to it.
But before the polls, are we hoping to, you know, open up for the rallies and big
Again,
events? I'm wondering how an election will be done without.
Well, but people have had to be very ingenious during this period because of what has happened. Now you see candidates from across the divide go into areas and spend more time on mass media than they would at mass gatherings, because they can have an opportunity to speak to the entire community and still get the message across. I recall when we got to, I think, Techiman with the president at 9:30 p.m. And I was one of those advising that nobody listens to radio at 9:30 p.m. So, Mr. President, maybe we should just pass the night and, you know, do tomorrow morning. He's like, I don't think so. You watch. And by the time we entered Techiman, people on rooftops, etc., and when he went on the radio, if you got out and went across, you would hear it all over, people on the radio. So people are finding ingenious ways to reach the community. It may not necessarily require the opening up for rallies, etc., but politicians have to find ingenious social media, traditional media, and then also these small teams that are doing the house-to-house campaigns. And who knows, maybe that will be changing the face of our politics moving forward.
We'll see how it goes, but let's go to the airport. And one controversial issue that came up along the line was a charge of the $150 for testing after you've tested the PCR. You had your PCR test before coming in, the negative test before coming into the country. Then you have to be charged another $150 to take a test again, which we are told you get in 30 minutes. And then you also told us that you agreed. The president actually announced that we'll get a mask once you get into the country. Some are saying that they're not getting the mask at the airport. They're still paying that fee. How come the mask is not being supplied? Yeah,
so with the mask, we initially, what the science or the thinking behind was to make sure that wherever you bought the mask from, if it's picked certain microbes or any is contaminated, we'll let you drop it so that we'll give you a new one. Yeah. But we realized that the discarding process and trying to get all the hundreds, sometimes thousands of masks out was rather going to, if you are not careful, contaminate the place. You had to get people to come for them. They would now be coming across, I mean, staff from the airport, even before they get tested. So then we reviewed that particular position. So it's not about non-availability. It was rather an infection prevention measure. Because in infection prevention, you want to avoid contact as much as possible. So we're like, if the gentleman has not tested yet, why do you let someone go in and be taking their mask? Even if you are gowned, there's still the risk of having microbes around. And that's why we reviewed it. And I think so far, the last time I checked, we've had about 42 positive cases from about 15,445 tests. And that comes to a percentage of 0.27%, let's say 0.3% positivity rate. However, like Minister mentioned, it took just 2 cases on the 12th of March to send us to a place where all activity had to come to a halt. And whether you like it or not, because this disease is not an endemic one like malaria, but an imported disease, your single biggest source of risk until the virus vanishes in the global population still remains your international airport. So if you have all arsenals, the single place to put them, assuming you have only one place to put them, is the airport.
Were they all hospitalized? There's 42.
No, in fact, in fact, about 99% were asymptomatic. Okay. In fact, you know, as part of our protocols, you ought to be first asymptomatic before you even present a negative COVID test. Okay. So almost all of them were asymptomatic. What happened was that it was those that had comorbidities. Let's say someone has a renal condition or a heart condition. Immediately you see those ones, you want to observe them in your treatment facility.
And this is a product of the profiling that we introduced. It makes a lot of difference.
Exactly. Yeah. So I mean, those are some of the things that, honestly, and I am convinced that if we had not had a testing regime that identifies the virus live, it is possible that our situation could have changed drastically. Because it's not just a positive test that is important, it's the viral load. The amount of virus you have in the person per liter of blood in their sample or in their respiratory fluid. If you have someone who has a very huge viral load, they are very contagious. And remember what happened at Tema. 1 or 2 people, the super spread, 500 cases at one place. So really, I am, and anytime I try to talk about the value of the test, people try to interpret it as an overly, what's the word, an overly something in terms of protecting the price or defending the price. But my point is simple. As a medic, I am very much interested in a solution that will pick a virus and in real time. And for some good reason, these two are available. In terms of the pricing and all that, Kojo is better. You know, there are people who calculate things that go.
They call it 15,000 by $150. I'm sure we'll start calculating shortly.
Yeah, but have you calculated the cost? 45 cases entering a population without being picked. If you multiply, you know how much it comes to.
well, but on this same company, the Frontier healthcare providers, this week there were some concerns about the company not getting the requisite regulations before starting operations at the airport. We heard Imani, for instance, they didn't go through HEFRA. I'm sure you've heard about
I read their piece and I was a little bit taken aback.
Why?
You are managing a pandemic. From the word go, if they tell you what you are dealing with is an outbreak, it means it's an outbreak because it's ahead of you. If you want to go through the traditional, I'm not talking about illegal parts, but most of the decisions you have to take, there are decisions where you need you need special arrangements because you are trying to handle a situation which is how do you call it, ahead of you. You try to catch up, and no country no country allowed their solution providers to go through their traditional steps. If it takes 3 months to, let's say, get HIFRA, and it takes, let's say, 4 months to get Allied Council to certify you, by the time you are done, you would have had, then our airports would have been closed.
But you have existing agencies and institutions that have all these regulations. So they've passed the test. Why didn't you allow them to do it?
FDA had to deal with this solution provider before putting their solutions at the airport. Those are ones that, even no matter how urgent the situation is, must be done. So we subjected ourselves to that. The rest are procedural. There are things that you do to validate or to legalize the setup. But really, that's why if you look at Act 663, even the procurement law, if you look at the conditions for single sourcing, it cites situations like this, where you are in an emergency or urgent situation where something must be dealt with. You are allowed to go ahead and deal with it and then take steps to make sure it's formalized. And the last time I checked, I think HIFRA is dealing with them, Allied Health is also dealing with them. These are things that would be done.
When was the last time we suspended church in this country and suspended school and locked down and had burial teams fully clothed like that, burying dead people? We're at war. We're at an emergency. And all measures that need to be taken to ensure that the population is protected, both health-wise, economic-wise, have to be taken.
But Noguchi was already testing. Couldn't we have used them?
Noguchi is not doing an antigen test. This test that is going on at the airport.
But we had Professor Ampofo come to defend what we're doing at the airport. At one of your press
Ampofo is the one who's been coordinating all of the tests that are going on by various labs across the country. But Noguchi has been doing an excellent job in our enhanced testing and our regular PCR testing, so as the other labs across the country. We needed a specialized solution at the airport, which can find the virus in less than 30 minutes and enable us to also even prevent you from queuing. Let me tell you something. Some of the policemen and immigration officers and drivers who contracted COVID-19 at the airport contracted it because in the mandatory quarantine exercise that we were doing, the policemen and immigration officers who had to stay with people and usher them into vehicles, etc., got exposed and contracted it. Imagine if any one of them had died. And so you now needed a solution that even ensured that people don't stay in a queue for long at the airport. It was a specialized solution that we needed to go for, and we went for it. And let's be blunt. There are persons who also see some of these things as economic opportunities. And once they don't get it, will seek to raise a lot of
taking advantage of COVID to enrich yourself.
So listen, let's focus on what has been working for Ghana so far. It's been a brilliant solution. Those 2 cases that took us to about 7,000 cost us 299 lives and tens of millions of Ghana cedis. If all that has to happen is that I have to pay $150 for a test so that the state doesn't have to go through all of that again, it's a better deal.
There's a demand for a probe on how Frontier Healthcare got this particular contract. You've heard the minority
I don't think
ask for that. They describe it as shady.
Well, the minority says Franklin Templeton is a human being. These are not things we worry about. If they want a probe, there's a very good avenue to have a probe. There's Parliament, they can raise a question on the floor, they can ask for an inquiry into it. But this political pot shots, I'm sure you've seen it over and over again. We should be getting tired of it.
Is it an offshore entity?
Say again?
They say it's an offshore entity traced to Dominican Republic.
If somebody wants a probe, there's an appropriate platform to get it. This business of always trying to, I'm sure you recall that the NDC was the one that formed the NDC COVID-19 team. And initially started making all sorts of arguments and speculations and ended up encouraging parents to take their children from school. There's always been an effort to politicize these matters. Tonight, for example, we've not been talking politics and we would like not to get drawn into those ones. If somebody genuinely wants a probe, Parliament is coming back. You can file a question, you can ask.
It's the final edition, so we
don't want to get into all of this.
No, but of course, the questions we need to ask. But I've seen, in preparing for the show, I've seen a communication from the U.S. Embassy on their page, you know, largely asking people who would want to travel to Ghana to reconsider their travel to Ghana due to COVID-19. I don't know if you've seen that communication. It's dated,
yes, not just
21st September.
Yes, not just the US. A few other countries still keep us on their travel watch list because we still have active cases in Ghana. And I think it has taken a while for all of us to now do the reporting that focuses attention on the active cases. So there are countries that are still worried, and every president is taking his own decisions, despite how they are managing it within their borders, taking his own decisions on how he thinks he can limit exposure of his people. So you can't begrudge them for that. You can only keep engaging them and explaining to them how very well we have managed our situation here as compared to many other countries, including the US itself, and why we don't think it's such a big risk coming to Ghana.
So it's not something that we should be worried about, because there's something that it means that they do not trust the process that we put in place or the things that we've done in terms of our management of the COVID-19 situation.
No, as I've said, every president, every government is taking his decisions. I recall our first travel advisory. There are cases beyond 200 in a particular country. So everybody's doing his.
Okay.
But on the bilateral level, you can also engage and explain what you've done some more, and if there are some misconceptions, proceed to clear. The world itself is not in ordinary times. And I think some of these things must be understood. So
over 40,000 recoveries and discharges. Some of them were hospitalized. We've said that the cases in the hospitals now have gone down drastically. But how much did it cost us? Because treatment was free. Do we know? Have we put a figure to it? This is the
I
final
think they would
show
have to work up the numbers. We are not out of the woods yet. We haven't completed the exercise, and it's still an ongoing exercise. They would have to.
But at the last count, where were we?
I honestly do not have a brief on cost in terms of monies, because we are still very much in the middle of this exercise, and that's why I'm saying that by the time they are done with it, they'll put all of these numbers together. Mind you, once public monies are involved, they will be accounted for and audited. And if anything inappropriate has gone on anywhere...
But along the line, you should be sharing with us, shouldn't you?
In the middle of the exercise, I'm sure, for example, if they say they want to find out how much they paid the health workers in February, or March or April, those specifics can be put out. Yeah. But we are still very much actively in the middle of the exercise. Indeed, today, if you followed our press briefing, we are worried about what appears to be the second wave showing up in parts of Europe, which are now open to travel to Ghana despite our two-tier tests. And it gives us a bit of discomfort. We're having to be very stringent with the test and monitor what is going on there. So we are very much in the middle of the battle. By the time we are done with it, I'm sure they can account for all of these numbers. At
this point, listeners are itching to join us with their comments and, impact stories about the lockdown now, beyond the lockdown and the final lockdown. So let's bring in some of them at this point. This is on Facebook. And Sharif Abubakar says, please find out from the Deputy Minister why the Kolebu Teaching Hospital frontline workers aren't paid a pesewa for their 50% promised by the President. I mean, no front President listened to us and lifted the lockdown. I think JoyNews really highlighted the plight of the poor, and the President had no choice but to lift the lockdown. Indeed, the President listened to JoyNews. More of your comments. Okay, so we'll take more of the praise singing at this point. Well deserved. But Dr. Okobo, you have a question on Facebook. Frontliners at Kolebu, which you were watching.
I've been engaging some of the emergency team, the health workers in emergency at Kolebu. And the last time we spoke, I wanted them to let me have whether it's a petition or their request. But I think they took my advice. I made them understand that it's better when their management handles the case, because it's the management of the facilities that validate those who qualify to be in the front line. And what we agreed with all the stakeholders in terms of the definition is that you should have managed a confirmed case at your facility. Because there are a lot of people who think that once you are a doctor or a nurse in a health facility, then you are a frontline health worker. But that is not actually correct. Which is not the case, yes. So we've told them that, once it goes through the motions and we confirm or it's validated that you really are frontline, why not? It's something that we'll do, and we'll continue engaging them.
Because it's something that comes up every time you're on
My
the show.
roommate in school worked as one of the frontline doctors who used to go and visit cases in their homes. He used to call me all the time. He stopped, and I called him back. He said he's arrived. That's why he stopped calling me. So some of them have received, in fact, most of them. But we do admit that because there's a process in validation, you can have someone who along the line maybe misses validation or is taken out of the list instead of being part of it and all that. What we've told them is that the first point of call is the management of the facility. Then they will bring the request to the region, and the region will bring it to us. And then once it goes through the motions and we are satisfied that this is a frontline worker, we would submit and we'll commit ourselves to.
Is this really true, or is just a hoax? Because it's like every time it comes up that you haven't paid the frontline health workers, then the issue about whether the person is really a frontline worker, because the people that text say that they've been identified, they've been named as frontline health workers, but every time they have not been paid, you say that they should check if they are really frontline health workers.
That's why Dr. Okoboy is making the point that it is best when the health facilities are the ones making this argument, because then the health facility will be able to say, I have submitted a list of 14 persons who acted as frontline health workers in my hospital for the month of March, and they have not been paid, or everybody's been paid and they have been excluded. That now puts it in a context where you can clearly validate, because there's a specific hospital, they are claiming they've submitted the list, they are claiming payments have been done and these persons have not been included. If you don't have that, you can receive a text message on the TV that says, I'm a frontline health worker, I have not been paid. And we're not in a position to validate any of those. Because the reality is that not every doctor or nurse is a frontline health worker. For the purposes of this exercise, frontline health workers is a nomenclature for persons who have actually handled positive cases.
So as it stands now that our active cases are down, if you are not handling an active case, you are not a frontline. You will not.
No. So in fact, you can be in a position where in the month of, let's say, August, you qualified for frontline because you manage cases. If in September there are no cases, you don't get paid.
So for example, in the 5 or 6 regions now that don't have any positive cases,
you are not a frontline.
You are not handling any case. So the regional directorates are not going to forward us the list of any doctors or nurses. So you may be there saying that, but I'm a frontline health worker, I've not received anything. And that's what we've tried to explain over and over again. The frontline health worker is a nomenclature for persons who have been handling positive cases. And the lists are compiled by hospitals, it goes to the region, comes to Ghana Health Service, then they go through the validation process and then they pay.
So the public health workers that were raising concerns some time back that they were burying COVID-19 cases and they've not been paid the frontline benefits. So if they're not burying, they can't be frontline health workers.
But that's you've moved from...
No, because they also...
No, I get a point. It's a different creature. But the point is that we've come quite a long way, you know. When we started the discussions, it took a lot of stakeholder engagement to arrive at what the nomenclature means and who qualifies to be part of it. So if, let's say, 5 months down the line, 6 months, you have a situation where, let's say, those who handle the environmental officers say that, okay, one of our members has contracted, so we should now be part of the front line. I mean, that is a request which has come, I mean, later. But, you know, I am not the kind of person that always shoots or discards opinions or suggestions. I mean, that's their opinion that they must be included. But that is not the case now as we speak. The frontline list is a dynamic one. You can manage a case in, let's say, June, because you had the case in your facility. So you can be paid 50% for June. If in July you don't have any case, you don't get paid again in July. And we should also understand human nature. If I were to still be working in a hospital every day, I would find ways to make sure I am captured in the 50%.
So you for instance, you are consulting for LECMA during the COVID.
Mine is a special case.
So did you benefit?
No.
If he brings his name,
you will pay.
Mine is I don't take salary or anything. It's pro bono. You know. But I think this point is very important. Every worker in the hospital setting, from the security man to the guy at the morgue, are all exempted from income taxes. You know, that particular step was taken by government, for that matter, His Excellency, to show appreciation, to also admit that once you are in a hospital setting, you are at risk. It was done because of the risk factor. So it's not like we are saying the one who manages the confirmed case is the only person at risk. But beyond that basic one, beyond the income, the tax exemption, we went the extra to the 50%. And I always use my roommate as an example. Look, when COVID started, people had all kinds of impressions about COVID, even health workers. Yeah. There were health workers who contemplated either going on leave or traveling out or going to the village. But this 50% helped to get some to present themselves as the volunteer group to manage the case. And I remember I always use my roommate as an example. My roommate is one person who would never take even the lowest risk, let alone a virus that can kill. But surprisingly, he called me one day and said that he was visiting COVID patients at home. I'm like, how come? He said he's even calculated the 50%. He wants you to buy a vehicle already. So he is a typical example.
Maybe because he's your roommate, that's why he's benefiting.
No, but my point is that he's a typical example of what a 50% did. Okay. Where one person who is very risk averse, for some reason, this 50% would say that I want to be the one to be interacting with a confirmed case. And he did a good job. In Accra, most of the cases that were at home when we started, those were in self-isolation. He was one of the physicians going to their home, take their temperatures, give them drugs and all that. And this is someone who would even go near the lowest risk. So MFR, it's important to always mention the tax exemption. Okay. That was across board. So that the impression is not created that we selected some and left others out.
Okay. Well, we'll take a quick break here on the final lockdown. And when we return, we'll tell some of the impact stories. And then, of course, we'll bring in Dr. Patrick Aboagye. Please stay with us. We'll be right back. You're welcome back to the final lockdown here on the JoyNews channel. We're also live on DSTV channel 421, GoTV channel 144, affiliates across the country. Also on Joy 99.7 FM and myjoyonline.com. Also on YouTube, on Facebook, you can watch us, and also on Twitter. I see all the comments. We'll go through as many as possible. And like I said, Sunday evening slot is not going anywhere. We're introducing a new show right here, and I'll let you in on it before it starts. But my guests are still in the studio: the Deputy Health Minister, Dr. Bernard Okoboy, Information Minister, Kojo Ponkroma, and Dr. Patrick Aboagye joins us in the studios, Director General of the Ghana Health Service. Welcome, sir. Are you still as busy as you used to be with the management of COVID-19?
Well, busy. Beyond COVID, there are other things. And this is the time that we're also making sure that we keep it down. So we are not going to let our legs off the paddle.
Your nurses and midwives this week, had issues. I'm sure Dr. Okoboy will also speak to it. Is it something that we've been able to manage? They have concerns about allowances and all. I'm sure it affected work at some point.
Well, I think the discussion is ongoing, and I'm not here to say whether they're asking for was legitimate or not. But I think we were talking, and now it's good that we are back.
Telling us if it's legitimate or not. How you feel about it? There's nothing wrong.
Talking to ensure that we get the right temperature for all of us to continue. But we are happy that they called off the strike so that we can continue talking and continue doing our work, especially when we are still in, so to speak, in a pandemic.
Okay. Well, and the Director General is in the studio, so they are all wearing their mask at this point. He's brought some order into the studio, but of course it tells you that COVID-19 is still real. But Dr. Aboagye, you've been around the country, and how is compliance looking like in terms of wearing of face masks?
Well, I think there's been a significant reduction in the use of face masks, and I've also been seeing a lot of adverts and a lot of media, both in the community radio, just trying to encourage people to wear the mask. And so I think it's something we need to continue educating. But people are also coming up with all manner of unscientific ideas. I just spoke to a sister who had the mask below the nose. I said, why are you doing that? Also, I can't breathe. But what I do, I put a sanitizer on my nose.
To prevent it. Okay.
So I think we need to continue educating people.
This is serious. We have to do some more.
I haven't heard this before.
Yes.
Well, so it's a moment of truth at this point, Kojo and Dr. Okoboy. Did you at any point get COVID?
No.
In the management of the COVID?
No.
How come? Kojo, are you O positive? I've been wanting to ask this because as part of the sanitizer
I honestly believe that the grace of God was phenomenal in this process as I went through dealing with all persons, some of who later turned positive. In all, I think I ended up testing about 7 times throughout the entire process. Because, ministers were tested, the COVID team was tested, Parliament was tested, and then, some persons who had tested positive when their contacts were done,
But were you afraid?
Initially, I was scared. I remember one of the tests, I actually had to move out of the house temporarily during that period. I think I told you about it, yes. Because I have a little baby at home, I have kids at home, so I was a bit worried. But, this is the job that you swear an oath to do. So, scared or not, you still have to go about it. But, in the end, God has been good.
Dr. Okoboy, your minister got it. Did you get it?
Well, because I'm a physician.
It's fast, so that you can tell us.
No, I didn't.
You didn't? Okay.
Get COVID. And, all the things we do are risk reduction measures. So you only do them to reduce your risk. Now, you can have someone who is very, very strict, but it doesn't mean the fellow, you can have that fellow rather getting it. So I'm careful. We don't talk as if those who didn't get it did better at the protocols than those who had it. There's one thing about disease transmission. There are about 1,000 things must fall in place for a virus to move from wherever it is to get established in your system to cause disease. For some reason, maybe out of 100 steps, one will not fit or come together in mine, but in another person, all will come together. But we, like Koji said, we thank God that, our picture, I don't even talk about my picture alone, but if you look at some of the attitude that we witness from some quarters, it is, apart from our protocols and all that, God has also been good to us, because there were some who didn't observe some of the protocols, but are well and all that. And nationally, 299 deaths. Very unfortunate, because even one death counts. But immediately you look at what is happening elsewhere, you realize that this is a situation that is quite inspiring, and we have to work hard to keep the current state.
Well, I got to ask Dr. Patrick about it some time ago, so I know that he didn't get it. Or did it change after we spoke?
Oh, no, I think...
or should we test you again?
Oh, no. I've been in all situations where I felt I was very close and people kept calling me, are you okay? And if I don't appear in a day, people want to know. But I think probably God also knew that.
There was a time someone called me and said, this week, I got a strange call. I said, this week, I see danger around your office.
Hey.
Don't go to work on Monday. I said, where's all this coming from? And the next day I was there,
prophecies come inside.
But I think the most scary time for me, I recall, I think it was a Saturday night, we were in Akosombo doing some work when I got a call. And then the president explained to me that he was going to go into his 14-day quarantine, which in my statement I described as a self-isolation. And I was a bit worried. What would it mean for this fight if the unfortunate
If you had the opportunity, would you have changed the wording of that statement?
We learn, as Oko mentioned. We have not been perfect in this exercise. We have been learning and providing the service that is required of us. So why not? If I was doing that statement today, I'd probably not use that particular expression. But I think Ghanaians understood the intention.
Because they thought you were hiding something, that the president actually had COVID.
One of the things I've learned in this job, and I was having a chat with Oko, is that everything you do, there will be pushback. You have to be clear in your mind that you are being honest, you are being forthright, you are doing what is in the best interest. Time will prove you right. Time will prove you right. Thankfully, the president has been fine and has provided the kind of leadership that has brought all of us here today.
Well, and you've been with us throughout this whole journey on beyond the lockdown, on the lockdown, up until where we are today. But it's a good time to tell the story about how this show was also born as part of JoyNews, our responsibility, social responsibility, in terms of putting it together and educating people, because during the lockdown, people had a lot of questions. And when we always come to you, you tend to, give off your best. But I've been joined via Zoom by Fifi Kumsen, is our lead boss and all for JoyNews, and he can tell us how it all began then we can outdoor the new show. Also, Jojo Kobna has been the producer from day one. And our graphics guy also joins me, Nanane. Well, welcome, gentlemen. We'll start with you, Fifi. So quickly, tell us the story about how it all began, the lockdown. Fifi, you have to unmute yourself. Okay,
Sorry
perfect.
I mean, it was critical. We gave our audience the best coverage of this pandemic. We engaged the experts. There was a need to engage the government and ordinary citizens. Now, we had Fred Smith, the head of our health desk, on the beat, working to bring our audience the most reliable information regarding this pandemic. That's chapter 1, and that ends today, as you just indicated. The feedback has been awesome, and we thank our audience for connecting. Sunday Lead is the next, giving our audience even more.
And he just gave it out.
Sunday. Okay, maybe you'd want to talk about Sunday.
No, talk about it.
Okay.
Now that the cat is out of the bag, you can tell us about it.
Yeah, so essentially what we'll be doing is giving our viewers, our audience, an outlook on what to expect in the course of the week. This will be preceded by a detailed analysis of the issues. So before the week starts, you, our cherished viewer, will be given a sneak peek of what will be happening in the course of the week. So that's what Sunday Lead is coming up with. And it's going to be very interesting. It's going to be thrilling, and even more thrilling than the lockdown and beyond the lockdown. And
so the question is, who is the host?
Oh,
am I fired?
You are the host. Apo,
yay!
The big boss, MFA Apo, definitely will be in the hot seat, asking all the beautiful, wonderful questions to elicit the right responses from the people, the newsmakers here in Ghana.
Well, now that Fifi has let the cat out of the bag, the new show will be the Sunday Lead. I introduce that to you. And that's the Sunday Lead. It will be on every Sunday evening, Fifi. So it's just unveiled. You, of course, will not just leave you. We may not have a dedicated show for COVID-19 every Sunday evening, but of course, we'll still pay attention to it because COVID-19 is still real. And we're replacing this show, the lockdown, with the Sunday Lead this and every Sunday evening here on the Joy News channel, on Joy FM, all our social media platforms, myjoyonline.com, DSTV channel 421, GoTV channel 144. Well, my producer, Jojo Kobna, is also with us via Zoom, and of course the graphics guy. Before I come to you, Jojo, the man who just put it together, I've heard Kojo and Dr. Belado Kuboy describe it as a what, Jesus film, you said. Okay, so Nanane, you put it together. Always working within a short time. You need to be celebrated, my guy. How did you do it?
I think I was called to join the team. Interestingly, I think I was called to join the weekend team one Sunday, and then it became like a regular team. And I was thrown into the mix on the day that the armed forces were deployed. When Gifty Apia was giving us live feed, and had to do like a really quick flyer and artwork to share. And that day we actually trended, and it was interesting for me. Like, it was very interesting experience.
And that was your first. And that was your first experience.
Yes. My first job, like, I was thrown into like the game, like just like that.
Well, now you, Jojo, you have been the commander-in-chief of the lockdown and beyond the lockdown, Jojo Kobna. Hey, pressure. walk us through the journey so far, Jojo.
Well, I would say that it's been very great, serving viewers with the most important information. And if you remember, anytime we sometimes have our own plan, and then we go to Facebook, we solicit all the views, and then it changes everything, because we wanted to make sure that we don't just only set the agenda, but to make it very audience-driven. And so sometimes we actually plan, and then we look at what the viewers are saying. What are their big concerns? People are talking about lack of water in these times. I remember those times where 3 weeks lockdown, people are talking about how to eat, people are talking about the hunger virus. And then we decided that, okay, the show will be dedicated on hunger virus, how people are really suffering. And then it was very interesting that the president addressed that same issue. And when we were talking about water, the president addressed it, and the people were saying, oh, the president should give health workers an incentive. And then all of a sudden, the president announced it. And so we really felt very great. We're very happy that he served the needs of the people, and the president really listened.
Okay, and we'll continue same with the Sunday lead. Thank you very much, Fifi Kumsin. Thank you very much, Jojo Kobna, and of course Bismarck. I call him Nananie. He's a musician as well, the graphics guy. He sings as well. Thanks so much, guys, and we look forward to the Sunday lead. I don't want you to say when it's starting because there will be too much pressure at this point. But I have a number of messages, and this one says, anyway, the show has had a great run. I always picked info updates on COVID from the show for my company every Monday. It was a good source of info for Monday morning updates because Kojo's briefings were Tuesdays and Thursdays. So sometimes if you don't take care, you won't have new info. So before Kojo speaks, the lockdown speaks because he's here as well. Thank you so much, guys. But this is the final lockdown, and we just have a few minutes to wrap up. And I just want to hear how impactful it's been for you. And since the journey is still on, COVID is still real. But Dr. Patrick Aboagye, you were on a few times as well. So we can hear from you briefly, then we can take the final comments from them as well.
Yeah, thank you, MF. I think it was a very good environment that allows us to get to know what people really think. There were very, very questions that we took for granted, that we decided that this is something we need to educate people on. This information we need to find a place, we need to create some clarification. Yeah. We'd also create an opportunity for our critics to also give us an opportunity to answer the things that needed to be done. And I believe that's educated a lot of people. And I know a lot of people, we come here and everybody saw you, which means that people are really watching. Yeah. And so I think...
thank you so much, Dr. Patrick Aboagye. Now, Kojo, as for you, we started the show together.
Yes. No, I think, first of all, I'll say thank you to yourself and to your producers and to JoyNews on the multimedia platform for complementing what the nation has been doing with a very, very brilliant show like this. As Minister for Information, in the midst of a crisis like this, my job has been to provide as much information as possible and to respond to people's questions. And what you've done here is given me and my ministry and government task force an opportunity to really do this. I want to repeat my appreciation to you. I want to thank the President for his leadership. It's made a lot of difference in our lives. I want to thank the various agencies, Ghana Health Service, everybody else. Thank the people of Ghana for their compliance. And
your fellow Ghanaians.
Yes, our fellow Ghanaians. So we thank God for his grace as well.
That's all, Kobo, you have the final word.
Yes,
30 seconds.
Yes, let me also thank the members of the COVID task force. They've done a very good job, especially the chairman, His Excellency himself. A lot of deliberations go on, very deep ones, sometimes deep into the night. We thank him. Let me thank you, your producers, your guys. This is one of the most effective means for educating people. A lot of people watch the show. Okay. So we thank you for that opportunity. And in conclusion, I celebrate all health workers. From the guy at the entrance to the guy at the emergency, in the morgue, and the environmental officers. We thank all of them. Our situation is good because they showed up.
Okay. Well, I have a lot of pictures that I took with all the guests that came on to the lockdown and beyond the lockdown. Yes, we could put it out on social media later on, then we can all see them. But that's it for this edition, the final lockdown here on the JoyNews channel. Sunday Lead replaces it, and it will come up shortly, sometime to come. We'll definitely let you know. I am Memefa Paun. Thank you so much for allowing us into your homes and wherever you listen to us from. We are really grateful. There's more news when you log on to myjoyonline.com. Do have a good evening.